Welcome to the Smiles Are Wild channel, brought to you by Pediatric Dental Associates and Orthodontics. My name is Amy Morgan. We will be bringing you fun and educational videos weekly to help you take better care of your child's oral health care needs at home and on the go. Make sure to subscribe and turn on notifications to see all of our new videos. And remember, it doesn't really matter how you take care of your teeth as long as you take care of them from the beginning. My name is Amy Morgan, and I'm the marketing coordinator here for PDA&O. Today, we're going to talk a little bit about questions that have come up. So over the last few months, we've done several of these live broadcasts and covered different subjects and topics, such as how do I get my child to brush? How can I prepare my child for dental visits? What do I need to do as a parent for that dental visit? And out of all of those videos, you can go back and watch them here on our Facebook page, or you can actually go to our blog at smilesarewild.com and see all of that past content. But we've gotten some great feedback, but we've also gotten a lot of questions regarding kind of what has developed out of those subjects and those topics. So we're going to go over 10 of the questions that have been asked. We feel like these were the most important at this time to kind of cover. These questions vary by age range, subject, things like that. We strive to make sure that as a parent that you are educated in what your child needs for dental. I think a lot of times, especially new parents, were given a lot of information when they're born as far as their medical conditions and health conditions and things like that, but we're not always, given the right, information to take care of their teeth. And because technically when they're first born, they don't have teeth. So, and it just kind of develops and we just kind of go with the flow. And maybe there's some things we can do earlier to do some more early interceptive intervention to make sure that their teeth stay healthy while they still have their baby teeth and then growing into getting their permanent teeth. So again, we're going to cover those today. We're going to do 10 questions. You are more than welcome to ask questions in the comments and we'll get to those as soon as we possibly can. We love hearing from you. We want to know what you want us to be talking about. So we'll get started today. The first question I have is what age should I start bringing my child to the dentist? And that's one of our more popular ones. It always seems to shock a lot of parents, but the American Academy of Pediatric Dentistry, which we use an acronym of the AAPD, actually recommends that you bring your child to the dentist around age 1. So about the time they turn 1 with their first birthday, they have their 1-year doctor checkup, they also need to start going to the dentist. And from that age 1, they will go every 6 months. This kind of just helps them get used to coming to the dentist. It gets them acclimated to kind of how the process works within our practice. And we don't do any kind of like cleaning or what we call a prophy, where we actually clean their teeth till they're around 2.5. And we also don't do any x-rays. For this 1-year-old exam, it normally is a lap exam or a bench exam. With the dentist, they'll just kind of look, see how things are coming in, and we'll do a fluoride application. So the appointment's fairly simple. It doesn't take too much time, but we do want to start getting them used to coming to the dentist, because the more they know as they get older, it'll just be more familiar for them, okay? So let's get a head start on that and get all of your kids, as soon as they turn age 1, let's get them into the dentist, okay? The second question that we have is, how often should I replace toothbrushes? And this applies to everyone, no matter if it's a child or an adult, but toothbrushes should be replaced every 3 months. So this includes electric toothbrushes and spin brushes and manual brushes. Spin brushes do not have a replaceable head. So you actually have to throw the entire spin brush away every 3 months and replace it with a new one. Or you can use manual toothbrushes, which is what we give away here in the practice. And there are also a lot of electric toothbrushes that have replaceable heads. So those can be done as well. But you want to make sure that every 3 months you're replacing those for you and your children. And on the electric toothbrushes, I just want to let y'all know we do sell the Crest Oral-B brushes here in our practice. So we have a kids kit that comes with a brush, mouthwash, toothpaste, and floss picks, and that runs about $25 for that, and it actually, you can buy the replacement heads for that. And then we actually have an adult version. I believe it's called the Genius, and it runs about $80, and it also comes as a kit with some mouthwash and toothpaste and floss picks and things like that. So it's a pretty good deal. So if you're interested in that, you can always ask when you're in the practice. The other thing we want to talk to you about, especially right now, is that you should also replace your toothbrushes when there's been an illness. So if you have a child who's been sick, they need their toothbrush thrown away and replaced, because they'll continue to carry that bacteria and could possibly continue to get sick from that toothbrush. And especially if they all share the toothbrush holder, you want to make sure you're replacing all of them. I know in our area specifically, the flu has been running rampant around here. So if you do have any kids that have been diagnosed with anything that might be considered contagious, you'll want to go ahead and replace the toothbrushes, okay? Our third question is another popular one. Of course, we picked the top 10, and that is, why should I fix their teeth? They're just baby teeth. We get a lot of that from parents. Their child is diagnosed with, several cavities, and either due to a cooperation issue, or sometimes we understand there can be a financial strain there. But for the most part, a lot of parents, or not a lot, but some parents kind of don't understand why we're worried about fixing the baby teeth. So there's a lot that goes into it as far as science and all these other things that I could go into. But in the most layman's terms, the point is that we want to try to keep those baby teeth as long as we possibly can. There's numerous reasons why cavities on baby teeth need to be treated. Healthy baby teeth or primary teeth are vital to the health of the adult or permanent tooth. Untreated cavities on baby teeth can cause pain and infection, as well as can affect the health of the underlying permanent tooth. And they also, this goes into, if you're not getting them fixed, they could lose them earlier due to infection. So if you have a child who comes in with a cavity that ends up turning into an abscess due to non-treatment, then they'll end up having to lose that tooth. We actually have to extract that baby tooth once it becomes infected. Once we've extracted that baby tooth, there is a chance that they could lose the spacing for that permanent tooth to come in correctly, which then could end up meaning, orthodontics down the road, due to overcrowding and things like that. It doesn't mean that your child isn't already, needing orthodontics or anything like that, but this can, decrease the likelihood that they would need it. So, and if you have baby teeth that have cavities that you're not getting fixed, eventually it could end up affecting the permanent tooth as it starts budding into their mouth, okay? So there's a lot of scientific reasons and things behind that, but mainly it's just the health of the baby tooth can affect the health of the adult tooth. So we want to make sure that anytime any kind of cavity is diagnosed for that tooth, that we're getting it treated as soon as we possibly can. Question number 4 is, when should my child be seen for an orthodontic evaluation? We have a lot of parents who come in, and because we're a pedo ortho office, we have kind of a filter over to our orthodontist, in that we're really aware of what we're looking for and kind of what each child would need, and he's kind of given us a game plan. But we do want to make sure that, as far as the orthodontist goes, if there is a concern, that they're seeing the orthodontist around age 7. So by then, your child has enough permanent teeth for an orthodontist to evaluate the developing teeth and the jaws, which in turn can provide a wealth of information. The AAO, or the American Association of Orthodontists, has, all of them are trained to spot, even the slight problem that could, end up causing issues as they get older. I have a list here just of the kind of problems that orthodontists may recommend treatment while they still have baby teeth. So a lot of people think you have to have all your permanent teeth to start orthodontics, and it kind of varies on what's going on. There are several issues that can be addressed while the baby teeth are still in the mouth. A few of those we have listed here is an underbite, a crossbite where the jaw shifts side to side, crowded teeth, excessively spaced teeth, so meaning they have just a lot of space between each tooth, extra or missing teeth, and then thumb, finger, or pacifier sucking that is affecting the teeth or jaw growth. So we can work with you to get them to stop doing that. There's a lot of things that we can do as far as trying to stop that at home and things like that. But if you get in touch with an orthodontist early, we can kind of develop a plan going forward as they grow for whether or not they might need early orthodontics or if they can wait until they're a little bit older. Some kids that get early orthodontic treatment end up needing a second phase when their permanent teeth are in. So sometimes we do it in 2 different steps. So they'll have a phase 1 of orthodontic treatment, and then they'll have a phase 2 of orthodontic treatment. Some kids only need the first initial little straightening or whatever it is, or we're fixing one tooth that's out of line, and that's fine, and they may not need anything else when they're older. But more than likely, if they have a first phase, they're going to end up needing a second phase. And Dr. Jason's really great about going over that, kind of letting you know up front, kind of what the steps would be for that. But again, you want to make sure that you're seeing the orthodontist by age 7, if the dentist is recommending that they see one. Number 5, we went over this a little bit in detail in another video, but I'm going to give a brief version of this. And that is, how can I prepare my anxious child for dental visits? So we have a lot of parents that call, and even when they hear that their child's supposed to come at age 1, and they are like, they're not going to cooperate. This is not, going to be a good appointment. What do I do? And, there's 2 kind of philosophies here, or the way that I see it is that you as the parent know your child. So if they need everything explained, and they do really well when everything's explained, or if you just kind of surprise them with it, they kind of do better. So I know I always use this example. My child, when she's 17 now, but when she was 4, she was playing softball. She did not want to participate in practices. It was turning into a nightmare. And this lady walked up to me and she said, "Are you comfortable with her staying here by herself? Just drop her off." And that for me was a big ordeal. And I dropped her off, and she has done fine in sports ever since. She was just taking a lot of my anxiety about the situation and putting that onto herself, and then was not, cooperating and things like that for practice. So, there's 2 things. 1, explain it all and tell them. Or 2, for some kids, just show up at the dentist office. Don't let them get worked up over the upcoming appointment, especially if they've been to the office and they haven't had a great experience. You might not let them know they have an upcoming appointment. We do understand that some kids really do need that explanation, and you as the parent can make that judgment call. But we do want you to know, some things, we that we recommend that you don't do as a parent is don't talk about the fact that there may be an injection or anything like that. We don't want to bring any of that up. Don't talk about how it was when you went to the dentist as a child and how awful it was. That's one of the things we really strive for. And the reason that PDA&O was established was to eliminate the future fear of the dentist. So we want to make sure that if your child is 4 and 5 years old right now, they're having a rough time, that we're trying to provide an environment that makes them feel safe and that can allow for their cavities and their checkups to be completed. And then as they grow up and as they're, transitioning out of your home, they're still going to the dentist as adults. There's an age gap somewhere between me and people who are older than me where going to the dentist was not fun and at all. And so they're showing, that those adults were not going to the dentist when they got out of the house, even if they had dental insurance and everything. They just were not going to the dentist due to previously bad experiences. So we want to make sure that we continue to bring them every 6 months, so we're keeping them acclimated with the dentist. And that as the parent, if you think they need the explanation, let's give an explanation. But if you don't, it may be better for their anxiety or their nervousness not to really talk to them about it and just kind of show up. Obviously, if you show up and they realize where they're at, they're going to have a little bit of anxiousness and nervousness, but it's less likely that it's been hyped up for a couple of days. Okay. I had talked to some assistants a couple weeks ago kind of about this question. And, one of the things that one of the girls brought up is, we don't ever want you to, quote, discipline your child for having a bad dental visit. Like, we understand that it can be hard. We want to continue for this practice to encourage your child to get comfortable with the situation. So we understand that. We're pediatrics for a reason, and that's because we want to help them through this anxious time and get them to love coming to the dentist so that as young adults, they will continue to carry through with their 6-month checkups, even when you're not the one making their appointments anymore. So again, there's a lot to say there, but as a parent, you know what's best for your child. These are just a couple of recommendations that we have. Number 6, this one can get kind of lengthy, so I'm going to try not to go too off the wall with this, but this is, do you take my insurance? That's probably one of our number one calls is my insurance in network. I'm going to do my best to explain this in a simplified format. I joke that I'm going to have this panel where I'm going to bring in a bunch of parents and we're just going to do a big roundtable discussion live so that we can get an idea of different parents, what they're bringing to the table as far as their questions and their understanding of insurance. But as far as our practice goes, we ultimately file all insurances. So any dental insurance you have, for the most part, 99% of them, we can file them. We use electronic claims filing. So your claims are filed the same day you were in the office. So when you bring your child Monday morning, we see them and then that claim is processed that night. This makes for faster turnaround on payments, so you won't get a bill in the mail. So we don't send any invoices out until we've given insurance about 30 to 45 days to pay that. And the electronic claims filing allows for us to do that in a lot faster format. There's 2 basic categories for insurances from the consumer standpoint, and that is an in-network or an out-of-network. So what that means is in-network means that we, as PDA&O, have a contract with that company that may or may not allow a small discount on your out-of-pocket expenses, and we are given a fee schedule by that insurance company that we must always abide by. So, for example, if we're in network with an insurance and you come to us for that, then there might be a little bit of a discount that we're supposed to take in order so that you are getting better benefits. Out of network means that we do not have a contract with the company. We will still file this insurance for you, but we are under no obligation to discount your out-of-pocket expenses. In some cases, however, these companies will actually pay us 100% of your total due. Normally, that is on your cleaning. So if your insurance tells us that they pay 100% of their cleanings and you come to our practice, there are some that will pay 100%. There are some that will only pay a portion of what they consider usual and customary. And I'm going to give a brief example here in just a second about that. We want you to know from the standpoint of our practice and our policy and the way that we operate, we do not let insurance dictate what our treatment recommendations are. So it may be that you call back and you're talking to us about the treatment and stuff like that, and we've contacted your insurance and things like that, but our dentist will say, your child has a cavity and this is the recommended treatment. And that has nothing to do with what type of insurance you have, if you're in network or out of network, none of that matters. We address the actual cavity first, and then all the financial stuff is done later. An example of an in-network versus out-of-network, the easiest math I can do here is, let's say a visit costs $100. You're in network. They say they're going to pay 100% of that $100. Then what they're going to do is they're going to send me a check for $80 and tell me that I have to take off $20 of that because you're in network. Okay, so it's an agreed contract we have with them to take a lesser fee. If you're out of network and you have 100% and they only send me the $80, then you're going to be responsible for the $20. In most cases, your out-of-pocket expenses are not too much. So that's one thing we really want to stress to parents, is that the words out of network are not necessarily a bad word. Okay. So if you're coming in, every 6 months and you have to pay $25 a visit to come here because we're out of network, you just kind of have to make a family decision. Is that $25 per visit worth continuing to see our practice, or do you need to move to another practice that might be in network? Sometimes it can be harder to find pediatric dentists who are in network with a lot of the plans. we're happy to try to help with that. So you just let us know. I am going to give you a list of what we are considered in network with. So we currently are in network with most Delta Dental plans. So that's going to be Delta Dental of Arkansas, Walmart, Tyson, most Blue Cross Blue Shield plans, and most Cigna plans. And I say most because there are different levels of the Delta Dental, the Blue Cross, and the Cigna that we are not considered in network. It's a small portion of them, but it can happen. So we always like to just say that we're in network with most, and we'll look that up for you. We are also very proud to accept our kids, Delta Dental Smiles, and MCNA, any Tefra, and any Medicaid. So that's going to be any of the state issued insurances. You know, as a practice as a whole for the last 20 years, we have accepted that. We've never, you know, had a limit to how many we were taking per month. We take new patients all the time, regardless of the insurance. Okay. That brings us to question 7. What ages do you see for new patients? So right now, currently within our practice, we start seeing new patients at age 0 or 1 up to age 15. If you have an older child who needs to start seeing the dentist, most likely they are in the stage where they're going to need more of a general dentist. And so we'll be happy to refer you out to someone within our area who we feel would be a really good fit for them. Question 8, what do I do if my child has an emergency? This has got kind of a twofold thing. Number one, call us. If you feel like there's something going on with their tooth, give us a call. We do emergency exams. We also do what we call limited exams. A limited is where there's just an issue and maybe there's not any pain or anything like that, but you want us to look at something. And a lot of times that is like the permanent tooth coming in behind the baby teeth or in front of the baby teeth, and they have like an extra row of teeth. It's completely normal, but a lot of times parents want us to kind of check that out, and that's fine. An emergency would be any kind of like signs of infection, they've fallen, anything like that. We have an after hours line that's available for nights and weekends. And if you are ever in doubt of what the emergency may or may not be, it tells you as soon as you call. If you feel like this is a true emergency, hang up and call 911 or go to the emergency room. If you feel like you just can't wait for us to call you back, then go ahead and head to the emergency room. We can usually address small injuries and falls during this after hours sessions. We can also usually address any signs of infection. We want you to understand as parents that it's okay to reach out to us should anything occur. However, there's only one true dental emergency, and that is if your older child has completely lost their permanent tooth. So if they're at a baseball game, they get hit in the mouth with the ball or the bat, and their permanent tooth goes flying out of their mouth, that is the truest emergency that you can have. So you need to call us immediately. Do not let it sit outside of their mouth. Try to find the tooth. There's all kinds of things you can do, but you need to make sure that you're calling us so that we can get them into the office, because that is a true emergency. Okay. As far as you need to see the dentist now. We understand dental pain in the middle of the night can be, not fun for parents. And so we're fine to take those calls. And if you're seeing signs of an infection or they're a small child and they've fallen and then the tooth is chipped and things like that, all of those you can call us. But we just want you to know that the actual truest emergency is if their permanent tooth has been what we call avulsed, which means has been taken out of their head or their mouth. Okay. Number 9, this one actually got brought to my attention today, right before this, is why do my child's permanent teeth appear to be darker than their baby teeth? And is this normal? So I spoke to Dr. Jerry for just a little bit about this, and he said, yes, it is perfectly normal. Again, this question can get a little bit scientific, but basically the enamel on these teeth just forms differently. So the enamel on the baby teeth as they're coming in forms differently than the enamel on your permanent teeth. The reason there's such a contrast is because you can see both sets at the same time. So if you have a 7 or 8-year-old that's in between losing all their baby teeth and getting their permanent teeth in, there's going to be a stark contrast between the color of those baby teeth and those permanent teeth. So the permanent teeth are going to look a little like some shades darker than those baby teeth. When they are in the process of losing these baby teeth and permanent ones are coming in side by side, the comparison can be very stark. Once all the baby teeth are gone and their permanent teeth are in, this usually has been shown to be a normal shade. So usually once you can see all the permanent teeth lined up together and you don't have any other baby teeth in there, throwing off the color contrast, then everything will start to look fairly normal to you. Okay, so it is normal for the permanent teeth to be darker. It is one of the ways you can also tell, like when your child's in this stage of losing and gaining teeth, the darker ones are going to be the permanent teeth in most cases. Lastly, just very simply, number one, the calls and the messages that we get over the weekend, things like that, are what are your hours and how can I make an appointment? So we have 2 locations. Our Fayetteville location is open Monday through Thursday, 7 a.m. to 7 p.m. for appointments. We also try to see some patients every other Friday. Bentonville is currently open Monday through Thursday, and they're 8 a.m. to 5 p.m. So Fayetteville is 7 to 7, Bentonville is 8 to 5. We are expecting in the Bentonville location to open up some Fridays soon. So be looking for that. We'll start offering those as they become available. You may request an appointment on our website at smilesarewild.com, or you can just call our office at 479-582-0600. That particular number will allow you to schedule in either location. So our administrative team is in one location, and they schedule all of our appointments out of our Fayetteville location, even for the Bentonville location. Thank you all for joining us, for entering your questions. Again, if you have any other questions, you can always ask them. We always want to say just thank you for taking the time out to watch our video, watch our content, share our content, letting others know what's going on, here at PDA&O. We strive to make sure that we're keeping you educated. So if there's anything that you would like for us to cover in the future, please let us know. If you want to continue seeing what we have going on here at PDA&O, you can go ahead and like us on Facebook and Instagram by searching Smiles Are Wild. And don't forget, you can find other educational materials on our blog at smilesarewild.com. Thanks again for tuning in. We hope you remember that it doesn't really matter how you take care of their teeth as long as you take care of them from the beginning. Thanks for watching. Thank you so much for watching. Make sure to subscribe and go visit us on smilesarewild.com.